It is RSV Awareness Month. While often seen as a common virus that causes cold-like symptoms, RSV can lead to serious health complications, particularly for older adults. In the U.S., it results in tens of thousands of hospitalizations and tragically claims the lives of thousands of adults each year. Joining us to discuss what individuals can do to protect themselves and their loved ones from RSV is CEO and President of the Alliance for Aging Research, Sue Peschin. Good to see you, Sue.
Good to see you too, Mary. Thanks for having me.
So what exactly is RSV and what are the common symptoms?
Absolutely, and thanks for doing this. So RSV stands for respiratory syncytial virus, and it's a really common and really infectious virus that affects the lungs and the airways, and it causes cold-like symptoms like coughing, sneezing, and runny nose. And a lot of people think, when they think about RSV, they think about little kids. But older adults in particular are at very high risk of serious illness like getting pneumonia or being hospitalized and also dying from it. A lot of people can recover from it, but again, for older adults in particular, it can be much more serious. And that's why getting vaccinated is so important.
And older adults, you're seeing more of it each and every year. Can you give us a little bit of an idea of what the biggest concern is?
Absolutely. I mean, 90% of people age 60 and older have at least one chronic condition. And also as we age, our immune systems get a bit weaker. So it puts us all at higher risk of developing complications from RSV. The most common one is pneumonia. It often puts people in the hospital. Close to about 100,000 older adults are hospitalized each year with RSV. And we heard that over the last couple of years about hospitals getting overcrowded with RSV patients, not just little kids. And then, you know, some people do die from the illness. But the really good thing is that there's now 3 FDA-approved vaccines to help prevent and also lessen the severity of RSV.
Yeah, I was just going to ask you about that, the prevention options that are available right now. What are they?
So there's three different vaccines that are available. The CDC recommends that if you're age 75 and older, you should absolutely get the RSV vaccine. And like I said, most people between the ages of 60 to 74 are at high risk, and those who are at high risk of serious RSV disease should also be vaccinated. And by serious risk, that means if you have heart disease, any lung disease, even asthma, obesity. So check, you know, with your healthcare professional, check even, you know, with your local pharmacist about availability. And it's just really important to get it done now because we're in October already and you want to make sure that you're protected.
Can these vaccines be given at the same time as other vaccines like the flu and COVID-19?
Absolutely, and there's a new COVID-19 vaccine, and also you should get your flu vaccine if you haven't gotten that done yet. So it means a couple extra jabs, but you can get them all done at the same time, and it's perfectly safe.
CEO and President of the Alliance for Aging Research, Sue Peschin, thanks so much for taking some time to talk to us this morning. We appreciate it.
Thanks for having me.